As the fifth generation of COVID vaccines are now being rolled out, one question is how to overcome community hesitancy in keeping the boosters up to date. Most people want to resume a normal life, so why not vaccinate to achieve it? Why take the risk of a resurgence in the disease? This week I sat down with Pfizer Australia Chief Executive Anne Harris to get her take on the vaccine hesitancy. And Harris, always good to chat to you. I just want to come to where we are with the coronavirus. The United States has lifted its state of emergency and other countries no doubt will follow. What worries me is that after having had such success in rolling out the vaccine, that there may be now reluctance for people to get boosters. What's your own feeling on that?
I think that is a concern, and we really need to stop and really think about where are we in this process. We may not be at the heightened crisis phase of lockdowns and heavy restrictions, but there is still significant risk with COVID. The pandemic is not over. In fact, what we've seen over the Christmas period, in fact, that we've had significant numbers of cases, almost 15,000 cases. We've had, tragically, the death rate has tripled to almost 30 cases a day, 30 patients a day, and I think that that is a real concern. So we need to stop and really understand where we're at. The risk has not subsided, and we still need to take a proactive approach to protecting ourselves, and vaccinations are a critical element of that. The benefit right now is that the boosters are evolving just as the virus has been evolving. You're seeing more and more new variants coming through with the virus. But we are in a fortunate position that the vaccines that we have, mRNA technology, allows us to adapt the vaccines quickly, and the boosters that are now going to be available are available for the Omicron variants.
But you know, when you look at vaccination rates of those who have had 2 compared with 3 compared with 4, that it drops off significantly. So what do you put that down to, and do you think that in itself is a public health risk?
I think I put it down to how we're all feeling. We all want to move on from COVID. I think originally at the start, it was absolutely everyone's focus. It was on the news 24/7. It was front of mind for everyone. I think now we want to kind of put it in our review mirror. But the reality is the risk is still there. And I think the other piece is that if you've had your primary booster doses, what can be seen is that it is not going to protect you against the variants that are coming through. The booster is what's going to protect us. So I think what is critical is right now that we get back onto bring it front of mind. What is the research? What is the evidence? What is the evidence telling us? And the evidence is telling us that booster vaccines will have a protective effect and help boost your own immunity for the recurrent COVID infections which are occurring.
The Federal Health Minister has said that there will be the rollout of the 5th vaccination for people. That also brings it back to front of mind for those who may have only had 2 or 3 vaccinations to try and keep themselves up to date against these variants.
Minister Butler has been very clear about the importance of boosters, the importance of antivirals, the importance of still being vigilant and taking a proactive stance to managing COVID. And I think that's a really positive thing. And ATAGI's recent recommendations, which do allow anyone who's eligible anyone who's over the age of 18 is eligible. If you have not had COVID in the last 6 months or had a booster in the last 6 months, you're eligible to go back and get a booster. So I think not only the government, but I think all of us from a safety and health and wellbeing perspective should really consider now taking back action the same way we did at the beginning. We are a country which believes in vaccination. It has had a significant impact on our ability to get back to our lives. Now is the time for us to bring that front and centre and take action for ourselves and our loved ones.
But Pfizer has also funded some research which actually pointed to the amount of the economic wealth of Australia that was saved as a result of vaccinations. We know the speed with which the vaccinations came out. We now come 3 years later and people are getting back to some sense of normal. But there's actually a dollar figure that can be placed on that.
We wanted to understand what the impact of the COVID pandemic, the lockdowns and the national rollout of the vaccines, really what was that and what was the benefit? And so just late last year, a peer-reviewed journal the research study was published. It was conducted by BioIntellect and the Centre of Policy at Victoria University. And what that demonstrated was there was an estimated $181 billion benefit to our economy, which is really quite staggering when you think about that. And it had a broad-ranging benefit to a number of industries. So we saw that in tourism to almost $28 billion, into educational exports of $26 billion. It had a benefit of, in terms of jobs, of over 142,000 jobs. And even what I found quite staggering was that it had an impact on government finances of about $259 billion. So what it really demonstrated there was that the National Vaccination Program had a very significant benefit in sheltering us from a much more dire situation in terms of our economic impact.
But you and I have talked about this before, and there's also a health review underway, and that goes to the heart of having stockpiles of vaccinations, not necessarily for COVID, but for a range of things, making certain that public health becomes front and foremost in government's mind because of the economic impact if you don't have that sort of priority.
And I think you've picked up on exactly the point. When you think about what is the full value and the full benefit of taking action, and you truly understand that, it changes the decisions you make. It changes how you think about the cost of medicine as being an investment, and speed becomes a really important point. You don't want to wait. You want to have access to the most innovative medicines and vaccines as quickly as possible. And so the government is taking those learns. You've seen with the Halton Review, they looked at, are we well prepared for what we're going to do with COVID going forward? And it again emphasised having this broad approach to, and a portfolio approach to vaccines and antivirals. That is clear. I think the other part here is that as we move forward, there is currently underway an evaluation of how we are going to look at valuing innovative medicines and vaccines. It's currently happening, and it's so critical that we take the lessons from COVID and pay it forward. We need to fully understand the benefit of innovative medicines and vaccines in its total, not just how it saves costs in hospitals, etc., but how does it have this economic benefit in society? Because when you do, you make different decisions.
Anne Harris, always great to catch up with you. Many thanks for your time today.
Thank you.